What's up, guys? Welcome back to Cherokee Hacks Life. So, I haven't put out any recent videos lately on post-surgery workouts. Looks like a lot of you guys that have been subscribing have been definitely watching some of these labrum surgery stuff. So hopefully your recovery is going well. But I wanted to give you guys some additional workouts that I've been doing that I didn't want to just put out there without me actually doing them and actually seeing that they were effective. So I wanted to put them out there for you guys now, so that way you guys can start doing them if you come across these videos later or whatever the case may be. Or heck, there's like 3 of you that just had labrum surgery within the last 2 weeks. So these will help. So I put up a video before, and I'll put up the link here of the wall crawl one, where you're crawling up the wall, you're holding the doorknob, you're turning, and you're getting that external rotation that's necessary for your labrum to function properly. You know, kind of the movement that we all take for granted on a daily basis, tucking in your shirt, etc. But I actually found some other ones that I feel have actually been a lot more effective. Now they'll make you a little bit more sore. I just finished doing these actual workouts, and they do make me a little bit more sore, but I wanted you guys to be able to do it. And I wanted to make sure that you guys see what it looks like and are able to do them as well. But I had a little help from my little man here. He helped me make the video. And he was actually recording me do some of these stuff on the floor. Now most of these things you'll probably be laying down anyway, to be honest with you, and I mentioned this one before in the previous video. You'll probably be laying down. If you're a stomach sleeper like me, it's crazy annoying to be sleeping for weeks on end on your back because you can't put your arm under. So this is a slow way to train your body to do some of these things and get back to that ultimate rotation that you want. And just to kind of give you guys an idea, I'm exactly, well, about 1 month after getting my surgery. And for anybody that's ever had this surgery, this is actually really good. I'm coming straight up already. That's actually ridiculously good for 1 month, and I get to see my doctor tomorrow, and he's going to be like, wow. I'm almost sure of it, because usually it takes about 2 months to actually get to that point with your arm. Same thing goes for my rotation this way, and then straight up. You can feel I can feel the tightness, but it's definitely significantly better. If you guys look at previous videos, significantly better than before. But let me show you guys exactly what I wound up doing for these workouts that my little man helped me record. So check these out. Here I'm basically just laying down, trying to get the rotation going upwards and downwards, you know, kind of that robotic motion that you take for granted. If you notice, my other arm just goes straight back. I'm not able to do that yet, but that's a big improvement, because if you just came out of surgery, you're probably not able to do that at all. And then this is the same movement that I had mentioned before. You kind of crawl your way up. You should be doing this after the first week of having your labrum surgery, so that way you get that full movement. And then this one is if you're a stomach sleeper like me. Now I encourage you to do both with the pillow and without the pillow, so that way you can get more rotation in the arm. When you take off the pillow, you actually come down closer, so it hurts a little bit more. So your chest comes down closer, and your shoulders should come down a little closer as well. And when you put the pillow under you, you get a little bit more relief from it. So you want to make sure you rotate slowly, up and down, rotate to the sides, rotate down. You want to make sure you get that kind of movement. Now this next one, if you work in an office like me, you should be doing this one pretty often, and this one's going to hurt like a motherfucker the first week. Basically, you just put it over, stretch over. I didn't do it in this video, but you should turn your head just slightly to kind of get a nice good stretch out of it. Same thing goes to the side. These are all movements that we take for granted every day. I mean, imagine trying to put deodorant on and you're not able to put your other arm under your other arm, you know, your left arm under your right arm. So those are definitely workouts that I've seen major improvements from before. Things that I wanted to try out first before shoving it out to you guys, and hopefully they help out. Again, hopefully these videos are helping you guys, saving you guys some money on physical therapy, because literally these are the exact same things they'll have you do. Not the bed one, not so much, because really what they do is when you're doing physical therapy, they'll push it down for you. But I honestly didn't feel like you need that, at least not yet. I personally feel like you can actually get to that rotation on your own, and so far I have been. But that's pretty much it, guys. thanks again for all the subscribers. I'm at 100 subscribers, and actually, some people think that's nothing, but to me that's freaking awesome. So thank you to all of you guys that have been subscribing and watching my videos. As always, guys, whatever your goal is, whatever you're pushing forward to, make it happen. No bullshit, no excuses, make it happen.